My name is Dr. Josh Hurwitz. I'm a board-certified reproductive endocrinologist and infertility specialist, what we call REI, here at Illume Fertility. I grew up in a little town outside of Boston called Needham, Massachusetts. I left to go to college at Cornell University. After that, I went to Philadelphia for both med school and residency at Thomas Jefferson University Hospital. And then I moved to New York City for my fellowship in REI at the Albert Einstein College of Medicine. And I started here at Illume in July of 2006. This is literally the only job I've ever had since I graduated training, and I feel very lucky to be in the same place for so long. Okay, do you have any hidden talents? As a matter of fact, I do. So, little known fact, I can juggle. Used to be able to juggle 4, and I used to be able to juggle pins. Now I'm probably out of practice and down to like 3, and I can talk and like whistle while I'm juggling too, so that's definitely a hidden talent. I'm very passionate about treating patients for fertility preservation when they're faced with a diagnosis of cancer. And then, I do really enjoy the science of IVF and chromosome testing, what we call pre-implantation genetic testing of embryos. I think that's fascinating. And this burgeoning field of how genetics is impacting on fertility and fertility care is really a great intellectual challenge for all of us. I also just really feel I'm supposed to be doing this. I really do feel that way. And it's what gets me out of bed, what gets me going to work, and I feel very lucky to have found that in my life. If you could magically acquire any skill, what would it be? I have to tell you, this is so obvious. I've wanted to dunk a basketball my entire life. Not really gonna happen, but there you go. I spend a lot of time with my patients, and they know that. I really take the time to make sure they understand everything that we need to do and why, how all the pieces fit together, and how we're gonna help move them forward. And I want patients to know that we're invested in them, and I want them to have the information so they don't feel lost. Patients need help getting through this journey. It is hard to go from point A to point B in general, building your family. And when you're challenged by fertility, it makes it even harder. And if someone can gain energy from me and know that I'm their biggest cheerleader on the sidelines, and then we can make really good decisions together. My favorite question yet, do you have any pets? And please tell us about them. So I'm a dog guy. Sorry to any cat lover out there, there's no cats in my house. I'm allergic. We have 3 dogs right now, 2 big mutts. They're kind of English setter mixes, but they're mutts that we rescued. They're kind of twins. They're like identical, but we can tell them apart. They're awesome, Chewy and Pepper. And our 20th wedding anniversary, of course, my wife got jewelry, but I got a puppy. So we have a little cockapoo. His name's Biggie Smalls. We call him Biggles. I wish that all of our patients who are struggling to build their families knew the following. Number 1, they're gonna be okay. I think that's important to hear. I also want everybody to know that they're not alone. Fertility challenges are so much more common. We just won't talk about them because they're so personal and delicate, but you're not alone. And lots of people have the same challenges. And there's a lot we can do to help. It never is hopeless. We have a lot of things we can do to help.